Hi, I'm Petra Schulz with Mom Stop the Harm, and I'll bring you greetings on International Overdose Awareness Day from Edmonton, Alberta, Canada. Mom Stop the Harm is an organization of Canadian families who've been affected by substance use. We started in 2016 with the three of us. There were three co-founders, Leslie McBain, who lives in British Columbia, and Lorna Thomas, who also lives in Alberta, and myself. And all three of us had lost sons to substance use related causes. My son Danny, I have Danny's photo here for you. I guess it's hard to see. So this is Danny's photo. You can also see a gallery of all of our loved ones on our website. Danny died in 2014. He was one of the early victims of fentanyl in Alberta. And before he died, I didn't know about fentanyl. Actually, I didn't know that much about substance use. The information we'd been giving as families was not to enable to let people hit rock bottom, to practice tough love and those kind of things. We never really practiced that, but we also didn't have the tools to do things right. One of my greatest regrets is that I did not learn about harm reduction until it was too late. I also did not know about the high risk of relapse and overdose during a relapse. All these things I learned after it was too late for Danny. After his death, I realized that from media reports that more people were dying, but yet there was nothing coming from health authorities. There was no action from government. And so I started to reach out to media and to health authorities. And one morning I was listening to the radio, and there was a story about a warning about E. coli tainted spinach, that people should not eat that spinach. And I thought, why do we care about people and spinach? And here we have so many people dying from a preventable cause, and nobody does anything about it. So I started sharing Danny's story in media, and that's how I connected with Leslie and Lorna. And for the first time, I felt I had somebody who understood what I was going through, because previously it seemed like people were either blaming me for being a bad mom, or us having been not a good family, and Danny for making bad choices. A lot of blame of bad choices. He had choices to make, and there are consequences for choices. When I met Leslie and Lorna, I found other women who understood how I felt, the grief, the despair, but also the guilt, the shame that comes with it, and how we felt we had to do something about that. And I also met women who wanted to make a change. So together we started out simply by registering a domain name and starting a Facebook page. Now we have close to 1,400 Canadian families that belong to us Canada-wide. Now, many people join us to engage in advocacy, but many more join us because they need support. In terms of our advocacy, early on we worked for things like making naloxone, the antidote to reverse an overdose, making naloxone available widely and without prescription. And we were successful, together with other advocates and health professionals, of course, and we were successful in making that happen. As a movement, we also worked towards getting a 911 Good Samaritan law, meaning that if you call 911 in an overdose, you will not be charged, or at least in theory, should not be charged with possession. So these were some of the early aims, but really the big targets we've been working towards is decriminalization of people who use substances, and towards provision of safer supply. In terms of decriminalization, most of us really feel that legal regulation is where we should be. And I usually don't say legalization. I say legal regulation, because substances should be regulated based on the harm they cause, which is not what's happening at the moment. A substance like alcohol is way too widely available. And cannabis in Canada, while legally regulated, the regulation leans more towards commercialization than making the substance available in a safe and affordable manner for people. So these are our big targets that we are working on right now. And this is especially important during COVID-19 because there have been so many more overdoses right now with the intersection of COVID-19 and the overdose crisis. We find that supply routes are disrupted. You probably have the same situation in Scotland, I imagine. Supply routes are disrupted, and we have substances just becoming way more tainted. The other thing is that people are using alone more. Some harm reduction services are shut down. Sometimes people are afraid to access them. People are told to stay at home, to socially isolate and such. So that has resulted in huge spikes of overdoses. And British Columbia, for example, has seen record numbers not seen before. And this is really heartbreaking to all of us in the movement and those of us who try to keep our loved ones safe. As I said earlier, a lot of families join us for support. So the two areas in which Moms Stop the Harm work are advocacy, but also family support. In terms of family support, we have closed groups on social media for people who are grieving. Most of us in the organization have lost a loved one. Several families have lost more than one family member. And many families have lost a loved one and have other loved ones who are struggling with problematic use. So we have close support groups for grieving families. We also have our Healing Hearts grief support groups that normally meet in person. At the moment, some of them might meet in a park and such under COVID-19 conditions. Some have gone to Zoom meetings. And we are working on a project to start family support groups for families who have a loved one involved in problematic use, and we're trying to support that loved one and trying to support with a harm reduction approach and a positive approach that helps the person and helps the family. So these are projects we're working on at the moment. For International Overdose Awareness Day, our focus is on exactly raising awareness, reducing that stigma. One way of doing that, we have a series of banners. We try to have events, small and large, in various communities. This year, the money that we had set aside for those events, we are using to buy banners, or rather billboards, in communities like Ottawa, our capital, in Victoria and British Columbia, Edmonton, Calgary, Alberta, in Montreal, in Quebec. So basically with the message, overdose can affect anyone, and highlighting somebody's brother, somebody's sister, how a family is affected. Some of those we're using images from the International Overdose Awareness Day website, and for some we're using the images of our own loved ones, because we have found that the photos of our loved ones sends a powerful message. The photos and the stories of our loved ones is really our most powerful tool to open hearts, to ultimately open minds and get people engaged and get them to think differently and consider those aims that we are working for, like decrim and legal regulation. We also have a campaign for International Overdose Awareness Day. It's called the Blue Ribbon Campaign, where the idea is really to paint the town purple. Purple, of course, being the color of International Overdose Awareness Day. We encourage people to tie ribbons on trees, on lampposts, anywhere in public, in front of their house, in their community, and to engage in that way and raise awareness. And what we have found that in some neighborhoods, for example, neighbors have offers to also put blue ribbons around their trees or lampposts. So again, it's a way to engage and reduce that stigma and create awareness. Our folks in Winnipeg got an ice cream shop to make International Overdose Awareness Day purple ice cream. We try hard to get buildings and important structures lit up in purple. In Edmonton, we have an iconic bridge. It's called the High Level Bridge. That will be lit in purple. In the CN Tower in Toronto, we will have displays on the Burrard Street Bridge in Vancouver. So it is probably the biggest day, and we get together not only to raise awareness, but also to support one another and to remember our loved ones and to really, really show people that they matter and that they're important. And another way we show throughout the year a campaign we have is our memorial photos, where families gather in iconic locations in their city. We had one on a famous beach in Vancouver, on a hill above wineries in Kelowna and British Columbia, at Niagara Falls, at the Legislature of Regina in Saskatchewan, at an iconic bridge in Edmonton, which I took part on, and on an Indigenous land in southwestern Alberta on the Piikani Nation. We partnered with that nation to have a photo taken there, and people stand together with the photos of their loved ones, holding crosses or something that symbolizes their grief. Some of the Indigenous families that joined us held drums or blankets and such. And we reach out to the media with those photos and say, hey, these are the people that are affected. For one thing I'd like to talk about in terms of what makes us effective as an organization. As moms, we have that voice. We can share the stories of our children, but we could never go alone. So what we try really hard as Moms Stop the Harm, we take the lead from, for example, the Canadian Association of People Who Use Drugs, or other organization of people who use drugs, and what they do for their advocacy. And we do our best to amplify their voice and to share their stories and maybe put a different angle, different spin, but that we really work together with one voice. And many of us who are active in advocacy in our community, we work with others. We work with the people who use. We work with academics, we work with health professionals, with anybody who works in advocacy. And that's really what makes us strong, is this collaboration and the alliances with other organizations working towards the same aim. Other family organizations, but also people who use, and people in recovery, people in the wider harm reduction community. So if there is any message I would pass along to anybody, don't try to go to you alone. The strength is in numbers, but the strength is really also in our stories of our loved ones, and helping people understand that while an overdose can affect anyone, it is one of the most preventable deaths around, and people are dying not because of the tainted drugs. People are dying because of our bad drug policy. So we can change that policy. We can make the needed changes to move towards safer supply, towards legal regulation, and prevent future deaths that way. And that is just what our hope is, our aim, and what motivates us. Sometimes often we feel despair. We live with our own grief. I live with the grief for Danny. But then to see this preventable death occurring over and over really can lead to despair. But what's really important is to turn that despair around, turn it into energy, sometimes turn it into anger, but turn it into energy to work towards change. And I'm so pleased that I was able to speak to you today, and hope you have a wonderful International Overdose Awareness Day. Ours will start a little later, when yours is already wrapping up. And but we are united globally in this movement, and together we can make the changes. So do take care, and thanks for the opportunity to speak to you. Sending my love to you all. Thank you.